question where like what's sickle cell disease and how does someone tends to have sickle cell. So sickle cell by nature is an inherited disorder that usually affect the red blood cells, or in short the erythrocytes. When the erythrocytes, during the formation, the process of them being produced, there is a point gene mutation where there is a change. Instead of it becoming vialine, it changes to glutamate, or let me say vialine is hydrophilic and glutamate is hydrophilic. So meaning if something is hydrophilic, meaning it's afraid of water. Now here's the thing. So when someone has got sickle cell, the most affected part is at the site where the hemoglobin is formed. The hemoglobin, one of its main function is to transport oxygen, but once it's transport oxygen, it tends to change and forms a half moon type of a cell. And by nature, a red blood cell is supposed to be round in circle, and it needs to be flexible, not rigidity, because once it becomes in a half moon shape, meaning when it comes to a junction where there is maybe it could be a synapse. So if I say synapse, I'm trying to say there is two blood vessels joining at the same point. So if it's rigid, meaning it cannot pass going to the other side. So here's a patient who presents with a so-called sickle cell. They'll come in different crisis attacks, and if you're at a facility, let's take for instance you're at a district facility, a clinical facility, not at the hospital, first and foremost you need to understand the type of crisis that the patient has presented to. And there are only 4 crises so far that I know. There is a plastic crisis, there is a sequestration crisis, hypohemolytic crisis, and vaso-occlusive. So if a patient, mostly they usually present with vaso-occlusive, they will come into pain, just like the way I said. Once that cell has been affected, others you might find it in a way like if someone has got aplastic anemia, where there's short lifespan, because a normal red blood cell is supposed to stay for about 120 days. Now here's the thing, a red blood cell has been formed, but it's only staying for 20 days. Hence there is rapid declining of red blood cells in the blood. Hence there is low perfusion of oxygen to the lower limbs, mostly the lower limbs. Those are the types of people now you will see presenting, coming in and crying like, oh, I'm having joint pains, my stomach hurts. It's because of the deprivement of oxygen. Or others, it could be maybe there's a blockage of that rigidity cell that I talked of sitting there, and this is how you manage. So the management will depend with the things that you have at the facility. That's one thing that you need to know. First, do you have fluids? Make sure you give your patient a lot of fluids. First, cannulate and then give fluids. Apart from fluids, give a pain relief drug such as morphine or diclofenac if possible. Then if there is nothing more that you can do, it's better you refer to a higher facility where they've got all the equipment required for them to manage a patient with sickle cell. And if by any chance there is any antibiotic, you can put the patient on antibiotics. And if you've got emetic drugs, you can also try to give them such as folic acid. And if your facility has got all the right for equipments like blood transfusion, you can transfuse all blood. And That's all. Thank you.